Good evening, everyone, and welcome to our TBN Special, 1 year since COVID, a sit-down with Masters Health experts. I want to start today by throwing a graphic up here on the screen. There it is. You can see the date, March 12th, 2020, 1 year ago today. Now, this graphic was posted on Tower's social media last year, and it marks, what a day it was 1 year ago. You can see March Madness was canceled, Broadway went dark, and more COVID cases were arising here in New York and around the country. Now, in this past year, we've lost over 500,000 Americans from COVID-19. Our frontline workers have been on the front lines each and every day fighting this virus, and here at Masters, our health experts have been working hard to make sure we can return safely to in-person learning back last year and be able to stay all the way up until spring break where we are now. Now, today, joining me are three members of the Masters Health team: Director of Health Services Sue Adams, School Nurse Tara Eng, and School Counselor Stefanie Carbone. And today we'll talk a lot about the unpredictable year it's been and what the future has in store. Now, Ms. Carbone, Ms. Adams, Ms. Eng, thank you all so much for being here. I want to get started just, to start where we are right now. Obviously, cases are way down in the United States to just about 50,000 a day. Of course, this is in proportion to where they were back in January, let's say. Just give us an update. How are Masters numbers faring compared to the county and the rest of New York, at this time?
So I thank you, Logan. I just want to say, we have a lot to be proud of here at Masters because actually our numbers are really good in comparison to others. I had opportunity yesterday to look again at the New York State website, and we're still hovering around 5.1% in Westchester County, which is a little strange. It's actually a little bit higher in Rockland County, and it seems that we're maybe even a little higher than the city. Right, which is so I'm not quite sure. I haven't been trending them the whole way along, but as far as our numbers for the school, if you look at incidents, right now we're at about 4.85%, and I'm sorry, positivity rate. That's not incidence, positivity rate. So we are doing well in comparison to our peer schools. That is a little bit lower than everybody else via the New York State school report cards.
Yeah, and it's been pretty impressive that Masters has been able to stay open, for the last 5-6 months or so. What do you think that says about the job that our community has done since we've come back for in-person learning?
I'll take this. I think we've just taken a very balanced approach from the beginning of this. I know that there was some different feelings about opening a month late and not opening in September, but I think in the long run that turned out to be good for our community. It gave us a little bit of time to see how other schools were faring around us. We also didn't jump right on the testing bandwagon. We saw what our partner schools were doing and then looked at different testing options, formed the health advisory team, and really sat and talked about the best approach. So, this whole thing has been difficult. You never know if you're proceeding the right way because we're all sort of taking it as it comes, right? It's the first pandemic any of us have been through, right? So I think that we have been fortunate in taking a very slow and balanced approach. And it has really shown. I think the testing weekly and what that has done for our community has also been wonderful because we're getting some really great data that I think makes families and staff feel more comfortable about coming on campus.
Yeah, that's certainly good to hear. I want to ask you, Ms. Carbone, about schools being open or not being open for that matter. We're very fortunate to be in person for learning. That's an option for us, but a lot of schools have been shut down now for almost, basically a year, which is pretty unbelievable if you think about it. What effect are the school shutdowns having on children, especially young children, their mental health during this pandemic?
I, as much as the schools can open up, the better. Obviously, it's different for different age groups, but definitely the need for connection. We're human beings. We're wired for connection. We're social beings. So there's such to have that lack of connection and that interaction. Yes, there are children, teens that are suffering. Definitely, the numbers are increasing when it comes to mental health and depression and anxiety. I do know that for some kids, frankly, probably in our community, the remote world really worked for them. Some kids who are very introverted or they feel like they do better on a screen. I think it worked well for them, but I wouldn't say that's the majority. And I think the sooner we can get the kids, with where they feel it's safe to come on campus. I mean, I think here, with all the numbers and the testing, I think people really felt so comfortable coming back on campus that we've had. When we first opened up, there were a lot of happy students coming back on campus, and it was really good for their well-being.
Yeah, and Ms. Adams or Ms. Eng, either one of you could probably take this question. I just wanted to ask, I understand neither of you are really in the classrooms, in the common spaces during the day that much, but, since we came back to school in October and we had a lot of strict protocols in place, how do you think that students have done, especially recently, abiding to those protocols? Do you think there's been any shift at all in, people's vigilance?
Well, like you said, we aren't like out and about in the classrooms, but it seems like the social distancing is still, being done. When we do walk to lunch, we pass a few classrooms that are in the dining hall. And it does seem like all the protocols are still in place. And I think that could be seen with how we're just doing as a community as well.
Yeah, and I think that, just everything Tara said, but also just a second that, our data is showing that the testing data. And, I did want to mention too that when we first came back to school, the Westchester County Department of Health wanted us to quarantine anybody who was in a classroom, regardless of distancing and masking. And in looking at the data that they were getting in at the county level and the state level, they did move to allowing us to not quarantine automatically classrooms if we could really ascertain that everybody was distanced and masked. So that just happened. And again, we went through that cycle and everybody was okay. So, again, we are not showing any sign of spread in schools. At least here in our data. And I imagine that is the same throughout the county, or they would not have changed that directive.
Yeah, absolutely. And speaking of data, I really just wanted to ask about the New York State COVID-19 report card. Now, if you look in that, obviously you have looked on it many times, but you can see that just under half of the cases we've had at Masters have been from test results that have been outside of our pool testing, which of course happens every week now. Obviously, the school reports the pool testing results each week via email, but we don't always publicly release if there's a positive case that happened to come from a test that wasn't done on campus. Do you think that we should be notifying the whole community of those positive cases, even if they're not from our pool testing results?
So I guess that is some, I want to say, like misinformation in the sense that we notify the community about anybody that somebody might have been potentially exposed to, right? About anything that might affect our school community. Since we started the pool testing, that's really where the source of more of that is coming from. But I do want you to know that we are hearing about most of the cases that are happening outside, and I'm in touch with those parents, and we're keeping really accurate data. I mean, it's possible that somebody has been remote the whole time, might not have shared something with us, but we're talking to people all the time. And I do want to share, we went back through our data last night, and we found that we've had in 16 weeks of testing, 12 people positive in the pool. And 6 were students and 6 were faculty and staff. It's kind of interesting. And the faculty and staff are also equally divided, 3 and 3. The rest of those 46 that are on our report card were cases outside of the pool, obviously, but that doesn't mean that there wasn't communication. It just really depends how widespread something needed to be communicated. But everybody who needed to know about one of our cases was notified. But you also have to understand that's all very confidential.
No, yeah, I understand that things have to be confidential, but I guess I'm just wondering, if pool testing results get released and they say, all results were negative this week, but, in reality, there's a student who, wasn't feeling well, so they decided to get tested outside of school and that their test came back positive. In reality, there was a case, it just wasn't, in the pool testing. So maybe do you think it's painting a false sense of security that we're not sharing all of that information?
In most cases, we have communicated with the community. I'll tell you, a lot of the cases on our scorecard are also ones that happened over Thanksgiving break, Christmas break. A lot of these are cases that happened when we were not in school and there wasn't even contact tracing to be done. Once we did the contact tracing, there was really nobody to inform. So again, I will tell you, even though there are numbers up there, you got to understand that I have to report on everything that happens. Anybody who's positive won't test in our pool for 6 weeks. So we need to obtain their report. All that I need to report on. So after every vacation we're on, you'll see there'll be a spike in numbers of reporting because I'm not reporting while we're not in school. I'm not required to. So the day I get back, very next time you might see a spike in numbers because I'm going to hear about all the people and what happened to them during the vacation. But none of it affected our community, so no reason to communicate. Really, the communication tool is the report card.
And Ms. Eng, I do want to ask you now because I know that you have been involved in the COVID vaccination effort. Can you just tell us a little bit about what you have been doing and, what motivated you to get involved?
Well, I had first, volunteered through the Reserve Corps a year ago when the pandemic, was just, really at its peak. And then, that volunteer work kind of died down. And so when the vaccination rollout started to happen, the MRC, sent out an email to all the members asking for help. And so that's just really how I got involved. And then once I started doing it, I really, just loved doing it. I loved knowing that I was playing a small part in this, whole thing and in helping. And, everyone is so excited to be vaccinated. So it's a great thing to be a part of.
So Ms. Adams or Ms. Eng, can you just walk me through, now that there are boarders back on campus, what is the protocol if a boarder is to test positive for COVID-19?
So most times, Logan, we're going to first know about symptoms, right? Because we don't have on the spot testing. So if anybody develops symptoms of COVID, we will have them isolate. We would obviously screen vital signs, pulse ox. We will also figure out how to get them tested, but that person would be isolated. In the case of a dorm parent, right, they would isolate in their space, and we would, assist them, but they would also be working with their private healthcare provider. For a boarding student, we have a rule that they must be picked up within 6 hours. So all of our boarding students do have a guardian, if not their parents, a guardian that can come and get them. And then what we would do is, again, work with the guardian to get the proper testing done and work with them on a plan to come back to school.
Yeah, and with that, I know that boarders are allowed to sign out after school or on the weekends if they would like to go into town, to walk into town. And, for day students, since we've returned in October, the protocol has pretty much been that you come to campus in the morning and you're supposed to stay there for the day and leave once in the afternoon. Do you anticipate, it would seem to me like it might make sense to allow seniors who've typically had the privilege to sign out and walk into town during the day. Do you anticipate that could be reinstated anytime soon?
Tara and I were speaking about this yesterday. we would like to see that happen. I mean, I think from a health and safety perspective, I'm not super concerned about it, but it really is a question for the dean's office. So they would consult us on the health and safety part of it, but then like that's something that really has to come from the dean's office.
And I do want to ask about sports now. A lot of public schools, even some private schools in our area, have been able to resume competition, in the fall and in the winter even. And Masters has not had any games for almost a year now. Can you just, tell me, why are other schools going back and we're not? What is the reason for that?
What happened this year really is that the Nice Days schools that we participate with, most of them are not competing. So it's almost like if we were ready, we had nobody to compete with. And, as Mr. Condon said, very clearly yesterday, remind me, we also will not compete with schools that are not following the same safety guidelines as we are. So if they're not masking and if they're not testing weekly and doing all the other mitigation strategies that we're doing, we're not going to participate. So that's just, there's really been nobody to play. And so I agree with you. I'd love to see kids out there. The public schools have loosened up the restrictions a bit, but we just don't have the opportunity this year. So they're still working on it. If it changes, But.
So is it just that Masters is ready to play sports and other schools that we would typically play are not yet?
Yes, and I have to commend Mr. Condon and Ms. Medina. Like they brought this out, they ran it by health services, and then we met with the health advisory team about all this. So yes, I feel we are ready. It's just there's nobody to compete with.
Right, and so I want to move on now, Ms. Carbone. Whether or not schools are open, in person, the pandemic has just, been so taxing on people's mental health, from people losing their job to losing family members to feeling overwhelmed with schoolwork. And, in recent months, an Instagram account created called Mental Health at the Master's School has, included a lot of student testimony and shared concerns. I was just wondering, have you seen that account? And if so, what do you make of it? And what has the school's response been and going to be as we move on?
Yeah, I know about the account. I haven't seen it. I'm not on social media. I've been read posts from it. Broke my heart to hear the pain and the exhaustion and what the students were talking about. They're talking a lot about classes and schoolwork. And I think it was a place where students have found a voice. And what's really important is that there are conversations going forward because of this account, and maybe tweaking and finding ways to support our students mental health wise. Our campus is a microcosm of what's been going on globally. The increased anxiety and depression and trying to find balance between work and home, and the isolation, increase of substance use. What we're hearing from this account is really a microcosm, like I said, of what's been going on globally. And as a mental health issue, mental health concerns, it's all about, I've compared it to not just this campus, but globally, mental health professionals. We've been on the front line in the 25 plus years that I've worked as a licensed clinical professional. I've never in 1 year been exposed to this kind of intense pain and nonstop trauma and triggering. So when I say, my colleagues are probably tired of hearing me say it, but I talk about how we're sort of fighting this forest fire with some garden hoses, and that I think the answer is we have counselors, we're available. It's about all of us as a community, I think, trying to find ways to tweak and find ways to make things a little easier and a little better. The counselors, the health team, the administration, trying to figure out and hopefully maybe tweak some things. I know there's been talk about tweaking things around the schedule. I know hybrid learning is a challenge. It's hard for parents, faculty, and students. It's a challenge. I think we've all learned a lot of skills. I know I've learned a lot about myself in this last really year. And I think as we're fighting this forest fire, we've got the counselors, and I've said, let's all sort of step up together systemically as a community. Students maybe have some answers. Maybe they, with some suggestions, they can be part of the solution. And training, frankly, these other firefighters, as the counselors are with our garden hoses fighting this fire and maybe dousing fires here and there. Training some faculty, supporting faculty, giving suggestions on how they can support students. We've met with parents several times this year about how to support their kids. So it's a way, it's really it's a communal attempt, a systemic attempt for us all to try and find a way to continue to navigate this, if that makes any sense.
And Ms. Carbone, do you think that boarders should have the ability to take a remote day if they're just really not feeling up to coming in school?
I mean, that's tricky for me. I'm speaking really and staying in my lane very much as a clinician and a mental health professional. It'd be easy for me to say, yeah, it would be great if they could have remote days, but I'm not in charge of, the guidelines in the dormitories and I guess a need for supervision or whatever the reason they're not able to do remote. It would be great if they could. So, but I don't make those decisions. What I can offer is, and what we do is, and from the counseling center is, and we sort of hold a special, we love all the students here, but our boarding students, especially in times of now, we sort of bring them in and hug them in, not literally, a little closer. So we develop a relationship with the dorms and the students, and we let them know, listen, if you're having a tough day, we didn't get to talk about, we have these mindful meditation rooms. You don't have to meditate in there, but there's the rooms where they're dorm rooms. You can fit at least 2 people at a time. And what we can offer is to say, if you're having a rough day, reach out to the counselors, reach out to the health team, come and spend some time in the meditation room so you can have a space just to pause. You don't even have to do work, but just to sort of, we all need that opportunity to have a space that's safe. We can pause and just kind of be. So, I mean, I know it's hard for the boarders. And again, coming just from the counseling perspective and the mental health perspective, we continue to remind the boarders, you guys are having a tough time. Make sure you connect with us, especially because we know that right now you can't be in the dormitories. So come, we'll take care of you. We'll let you sit in the meditation room. We'll spend time talking with you. I wish, it's really, I wish there was a better solution. And I don't know what the answer is to that. All I can do is answer to what we can do, really as counselors.
All right, and speaking of mental health, I really just want to ask you all, obviously you're always a critical part of our community, but this year you've had to certainly work harder than ever to navigate this pandemic. What have you been doing to just manage yourselves and keep yourselves going during such a difficult period of time?
Well, I'm happy to answer that first. And I'm going to start with practicing what I preach. We talk a lot about self-care, and it's all about putting the mask on first so you can help those, the whole analogy, putting the mask on in the airplane safety guidelines, put that mask on yourself first so you can help those who need you more. So it's about practicing self-care. I have 3 awesome colleagues in the counseling center, Gretchen Campbell in the middle school, Dr. Roland Davis, and Lydia Whitney. It's all about supporting each other, sort of, if we're having a rough day, helping pick each other up. This is, again, a sort of a systemic community involvement and sense of support, self-compassion, setting boundaries, finding those silver linings, thinking about, gratitude. The word of gratitude is often used. Maybe people are sick of hearing about it, but it really, when we look for those so small moments, sometimes it will actually make us feel better and sort of keep plowing on.
I'll just say that, like Ms. Carbone said, our health team is just really supportive of each other. We talk to each other, we listen to each other, and as far as outside of work, just enjoying the family, exercise, taking in the fresh air when you can, all those little things, that are normally taken for granted. I think everyone appreciates it that much more this year.
And I have to say, I agree. Again, good self-care, supporting each other. For me, exercise is a big thing. Yoga, that's how I keep myself sane. And I think, we're all always rushing, right? I mean, this year taught us like we had to slow down. So like I had to really think about some of the things that maybe I'd been putting off, and self-improvement. So, I just tried to focus on doing some of those things, keeping myself busy, trying to improve myself. But again, I'm very fortunate to work here. I have a very supportive team around me. Thank God for Tara Eng. She is amazing. Really just keeps everything going here. So, I wish all this didn't happen, but I also try to just focus on being grateful for what I have. And if everybody in my life is healthy, that's, I'm blessed.
Well, I do want to thank you all, not only for your time today, but once again, just for everything that you've been doing for our community in the last year. And I know it's not over, but we wouldn't be here without the three of you and the rest of your colleagues. So thank you so much for joining me today. And thank you to you all for joining me on this TBN Special Report. Really appreciate you spending some of your Friday evening with us, and we will see you soon.